Did you see the message Pastor Edmonds said it's now streaming live? Okay.
Pastor, you're muted.
All right. Welcome, welcome, welcome. I believe that we are live here. We are gathering together tonight as a faith community, as a community here in the city of Pittsburgh and even beyond all of Allegheny County and even across the world, to those who are wrestling with this pandemic that we are facing. Of course, we recognize that we're in the midst of multiple pandemics as we fight healthcare inequalities, racial injustice, as well as COVID-19. And on tonight, we want to gather together for a conversation on trauma, vaccinations, and faith. How do these three coexist as we are in the midst of vaccination rollouts, as over 400,000 people have lost their lives in the United States alone. Sometimes 3,000 to 4,000 people are dying per day. We want to come together as a community of faith and lead a conversation that will grant us some wisdom. So prayerfully you are tuning in on Facebook, on YouTube, on our app, wherever you are. Maybe you're even watching this at a later time. It is our hope and our prayer that this conversation, these questions and answers with leading experts will grant you some wisdom. So I am giving a few moments as folks get onto this call. That we might be able to have a great conversation. I'm seeing on my other devices that we are live. Facebook and YouTube should be seeing us now. So I want to introduce our panel. We have a distinguished panel on today who's going to be able to share with us in this conversation to help us to process where we are with the rollout of the vaccine, where we are even in our emotions in this season, as well as how do we have the faith and wisdom to move forward. So joining us today are people from across many disciplines who are going to be able to provide some great insight. I am Brian Edmonds. I am the senior pastor of the Macedonia Church of Pittsburgh, honored to serve with so many of you all and so many of these people that are on this panel. We also have with us Pastor Shirley Lyle. She serves as the teen pastor at Macedonia Church and is going to be able to offer some amazing insight into her own personal journey with COVID-19 and the vaccine. We also have Dr. Chantel Villalobos. She is a third-year resident in internal or general medicine, and she is currently in Honduras, working in the field there. And so we're thankful that she's able to join us as well internationally. Thankful also to have Doctors Pettigrew. The Doctors Pettigrew, well known in this city as well as beyond. Dr. Chintis Pettigrew serves as a great resource in the medical community here in the city of Pittsburgh. He also operates to ensure that there is a diversity and fair representation across those who are serving and those who are receiving healthcare. Dr. Margaret Pettigrew serves in a similar capacity, but she's at the Allegheny Health Network. She also is working continually to make sure there's equity in our healthcare systems, and she is trained as a gynecologist. We also have with us Dr. Trish Gadsden. Many of you will also know her as a leader in social services in the city of Pittsburgh. She serves as the executive director of Macedonia Face, and has been a huge part of the rollout here in our city, especially in the Hill District. Thankful also for Dr. Mohammed Hagamed. He is an ER doctor right here in the city of Pittsburgh, literally just getting off of work to come and join us today. So thankful that you are with us. excuse me, Dr. Hagomed has been on the front lines, as so many others have been also. And so we're grateful for the wisdom and insight he's going to be able to share from that perspective. Then we also have Dr. Terrence Dermody. He is an infectious disease expert, a virologist who has done a lot of research in these areas. And so it's going to be able to offer us some wisdom on how to think about this vaccine, as well as some responses to some of the major questions that are in our community. As a community of faith and as a pastor, I want to open up this conversation with a scripture in the book of James. James writes, James, the half brother of Jesus, he writes, and he says, if any of you lacks wisdom, let him ask God, who graciously gives. And in this kind of moment in our history, a major thing that we need is wisdom. How should we think about this vaccine? How do we process our emotions? How do we help to be good neighbors in this kind of moment where the well-being of others may be directly dependent on some of the decisions that we make? To that end, I'm going to open us with a word of prayer. I know we have different faith backgrounds, so maybe streaming with us today. If you're not a Christian and not acknowledging this same faith background, we just ask you to join us in a moment of silence as I lead us in prayer. Almighty God, I thank you for this opportunity to gather with leaders and with experts, with folks who have been through some of this trauma in the last 12 months. God, I thank you for the way in which we as your people can come together to have conversations about faith and about vaccinations, about trauma that we've experienced. Give us wisdom. You said in your word that we should ask. So we're asking today, and we're following through on being the good neighbors you've called us to be. In Jesus' name we pray. Amen. 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 And so, family, as we begin this conversation, I want to let you know, as you are tuning in from your different mediums, that you are able to submit questions. There are many of you on Facebook right now. You can submit questions right there in the comments. On YouTube, you can type your question in the chat. And on our app and website, if you're there, you can call a 1-888 number. Again, that number is 1-888-320-4099. 1-888-320-4099. Folks are standing by right now to help receive your questions. As those are coming in, I want to push us forward. So I want to begin the conversation tonight with some questions around how this pandemic is impacting some of these on the call in their personal and professional lives. So I want to begin with Dr. Hagomed, an ER doctor who I'm sure has seen more than many of us could even imagine. And I want to hear from you, Dr. Hagomed. How has this pandemic impacted you in your professional life, but also in your personal life?
Pastor Edmonds, thank you so much for providing me with this platform. I am so thankful and grateful to be here, healthy. We take so much for granted, and health is a huge thing that we take for granted most of the time. Yeah. And this pandemic has opened my eyes to a lot of things, including my own experience with myself and my just personal belief, as well as what's going on with our society. But I want to let you know, just to give you a brief background, I recently moved back to Pittsburgh. I was practicing emergency medicine in San Antonio, Texas, and just moved back here in October. And I'm seeing Dr. Pettigrew's face. It's just so nice to be here and so nice to see you again, and hopefully we get to meet face to face. But when I was in San Antonio, and as many of our colleagues, we initially did not anticipate that much of an impact from the COVID-19 when it happened. We thought it's just going to be a viral illness. It's going to be a flu-like symptom, and most of our patients going to recover with no issues. And then it's just started to hit us, like it started to hit most of the states throughout this country and throughout the world, is that by May, April, we're starting to see, oh, it's just people are presenting more acutely sick. They have a lot of issues. A lot of them need to be put on a ventilator on the machine. A lot of them need to go to the ICU. This is not the flu. This is something different about it. And initially, we were like, wearing gloves or just standard precautions, not the N95, not all these fancy masks that we now wear. And some of my colleagues got sick, and I didn't really anticipate the impact on not only my colleagues but also my family members overseas until one of our colleagues in Texas passed away from the implications and complications of COVID-19. So as a practitioner there, we started to take this more seriously, and we started to see, okay, we have to be more prepared. We have to look at the data and the science and look at what we have available in terms of the studies to learn how to impact. And as you all know, as clinicians, we have to adapt.
Yeah.
So we have been adapting until now. We still continue to adapt, seeing what we see and reading what we know now from the studies and the data. But personally, I can sit here and talk for a long time, but I can share with you many personal stories with family members of my patients and patients who had to pass away alone in a very different environment, foreign environment, away from their family members.
Dr. Ahmed, can you just tell us or give us a quick picture of a day in the ER when you are dealing with patients, dealing with your own emotions? Just a quick look at what that looks like, even as people are passing away alone. How does that impact you?
One word: was a long and exhausting, long days, long shifts. Yeah. I don't miss those days. There's sometimes when I see a patient and they look fine, they look okay, I'll take care of them the best of my abilities and admit them to the ICU. Even before they go to the ICU, they just deteriorate in the ED in front of my eyes within hours of their presentation. So I had to sit down and make that difficult phone call or difficult conversation with their family members that their loved one just passed away.
Wow.
And initially it was something that has sit on me for a long time, because you just keep carrying that weight of grief and sorrow on every shift. Yeah. So I started my shift. Everybody's prepared, obviously. A lot of people are already tired and exhausted. And these patients initially required a lot of resources. I mean, not only myself, emergency medicine, also ICU, respiratory therapy, very advanced nursing, and all these equipment that had to be specially, just for them, like in terms of the machine, the ventilator, and the medications and all this stuff. And everybody has a different, unique physiology. Right. So that was in terms of the ED setting. An ED setting was always, we had people coming in all of the time. So we had to call people in terms of backup staff from home because we were short of staff, or some of our staff, as you know, might have gotten sick, or staff that, had to stay away at home, or because their loved ones also were sick, so they have to go and see them. So it was a huge burden. Yeah, it was a huge burden, not only mentally, but physically and also, psychologically.
Yeah. So what I'm hearing, right, is this compounding impact over the months, of course, as you are dealing with the deaths of patients, the fast deterioration, but also just trying to grapple with your own emotions in difficult times like this. I want to come to thank you so much for sharing so much of that, Dr. Hagomed. We'll come back to you as well. I want to come to Pastor Shirley, one of our own pastors at Macedonia. She leads our teen ministry, and I know now, and you're comfortable with us sharing that you are a COVID survivor. First of all, just praise God for that. You are a survivor, my sister, and I thank God for that. But I want you to share with us a little bit about how this has impacted you personally.
Yeah. Thank you again, Pastor B, for having me here. This pandemic has been both traumatic and painful. I mean, there's just so many other words that can be added to that, but mainly just being traumatic and extremely painful. When you think about like work, how we've had to shift to like virtual education and telehealth, it's like creating a new program in the midst of uncertainty. We're trying to support people that we supervise who are afraid, as well as trying to find work for them. None is available. And then, you know, when it comes to just racial trauma, just as a supervisor and a Black supervisor being shifted into a position of just being thought of as an expert on racial trauma. So work was hard and really overwhelming. Family life was really a struggle. Just the fact that everyone's afraid of this, of COVID-19, of catching it, of me catching it, of them touching something and getting it. They were just hyper paranoid. Just the mental impact of being home, not being able to socialize. You know, you have teenagers in the house. They're just not used to this type of disconnection. And just trying to learn how to do family life and everything with so much work. When you think of it, there's just so much going on and you don't really get a chance to really support your family the way you would like to. And then grief, losing loved ones in the midst of this pandemic. Some passed away from COVID and others just passed away and not being able to go to Jamaica or go to the places you want to really be with your family.
Right.
I think
let me just cut you just to share. I know I heard you say Jamaica. Some people don't know that you've got ancestry in Jamaica. So just being able to travel, right, a distance to get to where family members are is a burden. Let me come even deeper for you, Pastor Shirley. So you talked about these fears, but then you contracted the virus. You got the virus, and so how did it impact you personally? I mean, some people don't even know, they've never heard somebody talk directly about, hey, this is what happened in my physical body. And then if you're willing to talk about just some of your other family members that were impacted as well.
Yeah. So everyone knows I'm a germaphobe. I wash my hands, I sanitize. I was born a UPMC kid, so we learn front, back, 20 seconds. This is nothing new to us. Wiping down door handles. Grandma always said, you better not open that refrigerator if your hands aren't clean. And when you come from the outside, you wash when you come in. So you could have never told me that I could have contracted this virus, ever. When it happened to me, it started out as, you know, I felt a little weird. I'm very sensitive to my body. I know smells, I know differences and just anything that's happening to me. So I felt just a little bit weird. And then all of a sudden I had a headache. I know some of the symptoms of COVID include being feverish. And so I didn't know the difference between being feverish and a headache. So I just started taking my temperature. And then all of a sudden I had a fever. And it was kind of strange as doctors were asking me, do you have this? Do you have that? I was like, no, 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 no. And then all of a sudden I started having those symptoms. And I was like, the devil is a liar. Like, I'm making this up in my head. They said it and I'm claiming it. Maybe something is going on in my head that I'm making this crap up. But it became apparent that this was beyond a headache. It was beyond a sickness. When I start, you know, having difficulties, like, you know, tasting and smell and things like that, I began to realize I wasn't just picking up on what doctors said. It was really happening to me. Yeah. When I contracted the virus, it was a lot. I'm a single mom. I'm working double overtime, trying to create a new program. And I was hit so hard with fatigue, with just sickness. It was like beyond a flu. Like the last doc said, hey, we thought it would be flu-like symptoms. I thought it would be like a severe flu, but the fatigue, the exhaustion, even phlegm and things coming in my chest, just all of those things, it was overwhelming. Like so much fatigue that you feel like you can't get up and prepare a meal. Like the brain fog, just like not even remembering things from today to tomorrow. A lot was going on. And unfortunately for me, all the managers were off the week I caught COVID. So I had to press through some because the rest of the team needed me, but I also had to try to take care of myself. So it was a lot and very scary because when I caught it, it was new. And my thought was, will you die? I mean, it was just, death was like, this may happen very soon. So who should I tell?
Yeah.
And things like that.
Wow. Wow. Whew, Pastor Shirley, thank you for just sharing the realness of your experience. Even as a young woman, it's important for you to share, because again, there's some thoughts that, hey, this is only really going to impact the older generation or those who are 65 plus in a negative way. But you're here sharing, hey, as a younger woman, I experienced this to the point where I wasn't sure if I was going to make it. Which is just something that has to be shared, and oftentimes by people who others know in their community and in their circle of influence. So thank you for sharing that. We'll come back because I want to hear some more about your story, and even now where you are in the journey, because we know that there can be some lingering effects. Let me come over to Dr. Trish Gadsden as a social service agent and a leader in the community. Just want to hear from you briefly about how it's impacted the way that you're providing social services and even those clients that you're serving.
Thank you, Pastor Brian, for just having this open and candid conversation. I think it's so important for our community. As you know very well, Macedonia Faith serves over 3,000 people per year, and our service delivery model centers on racial equity. So when we engage in community, we focus on equity, all aspects of equity, and one of the pillars of the way we deliver service is through community engagement, meaning that we are involved in the community, we are in the meetings, we are in the schools, we are in family homes, we are knocking on doors, delivering food. So when the pandemic, first it was described as this novel virus, was explained, it caused us to pause and pivot, because we weren't sure, how do we engage with community in a way that addresses opportunity gaps and equities in terms of health and wealth and food distribution and working in food deserts and delivering Meals on Wheels to seniors and addressing opportunity gaps that manifest in educational outcomes with students. And so how do you do all of that and make changes when you aren't able to engage? And then more importantly, how do you address the delivery of services when the people who are serving are of the community? I think of my Meals on Wheels team, where a good portion of those servant leaders are people who are working in their second career. So what I mean by that is that they've had very successful careers in one industry and then decided later in life that they wanted to give back to community. And so they're working part-time, and therefore they are the high risk. And so what does that look like for us? And so we were very early on separating ourselves into teams, making sure that we weren't coming in contact with each other, or that if someone else in senior leadership, we wouldn't see each other, so that the organization could continue to operate. And then thinking about, how do we use PPE and how do we use face shields in terms of delivery? Because some of the people that we serve, if we don't show up, they don't eat. They depend on us for delivery of things that they needed from the store. So this changed every way we operated in terms of the number of people who go into the office on a given day, and how we interact, but still how we make sure that we can help the community get the vital supplies that are needed. And then also how we engage in conversation with partners in health industry and county and city government around real issues of equity. Because what COVID did was shine a glaring light on the existing structural equities that impact under-resourced communities, and brown and Black communities. And so there is not a conversation that I have each and every day with any partner, funding partner or otherwise, where I'm not engaging in conversations about equity.
Wow, wow, wow. So I want to thank you so much, Dr. Gadsden, for sharing the ways in which this impacts your work. And I want to talk about this equity piece a lot more in our time today. But I want to make a shift here and start to get to some direct questions around this vaccine. And so that's going to continue our combo when we talk about equity, but I want to just dive in because I know that's some of the meat that a lot of folks are really interested in right now. There is a vaccine, or there are multiple vaccines now. Moderna, Pfizer, even Johnson & Johnson is now coming out with their vaccine. And so there are a lot of vaccines on the market. And so we have, again, a virologist with us. Dr. Terry Dermody is with us. He is the chair of pediatrics at the University of Pittsburgh. And so I want to ask some direct questions to you, Doc, and maybe hit you with some rapid fire questions that people want to get some answers to. How can we be comfortable with a vaccine that was developed in 10 months? Normally, what we understand, what we seem to understand as a public, vaccines take years and years to develop. Why should we be comfortable? Why should we be? Should we feel safe with a vaccine that was developed in that time frame?
Pastor Edmonds, how wonderful it is to be with you, and thanks for the opportunity. I so wish we could be together, just so that I could hear you and be with you, and you inspire me with your preaching. Maybe another time we'll be able to do that. You're right. This vaccine, I should say these vaccines, the two that have been licensed now, one by Moderna and the other by Pfizer, were developed and licensed in less than a year from the first discovery of the virus SARS-CoV-2 that causes the COVID-19 disease. And that's a world record. Now, it's in part, the speed is because the entire world was focused on development of vaccines to prevent the virus that caused a worldwide pandemic. So many scientists stopped what they were working on and started working on the virus with the intent to develop new vaccines and antivirals. What takes the longest period of time in vaccine development is testing in humans. That's what takes the longest period of time. And because of a tremendous amount of support from the federal government and the vaccine manufacturers, we were able to test these vaccines in absolute record time. And I just have to say, hats off to some groups that you all know about. Our Pittsburgh Vaccine Trials Unit that's led by Judy Martin and Alejandro Hoberman, and then the Pittsburgh Community Vaccine Collaborative that's led by Father Paul Abernathy and Jamil Bey, who did a tremendous amount of teaching with their community ambassadors about vaccine studies and how vaccines work. And I'll just share with you all that our Pittsburgh Vaccine Trials Unit, which evaluated Moderna, Johnson & Johnson, and AstraZeneca vaccines, had one of the highest rates of Black and Brown enrollment of our study subjects than any study site in the United States of America. And that's through the partnership with our community that was made possible.
Hey, Doc, can you give us the percent? Was there a percent that you have about the number of those Black and Brown folks who are part of those studies?
It's about 25% overall. And I would say about half and half Black and Latinx, about half and half of each of those groups.
Okay, great. So understand, all right, everybody's putting their resources toward this, and everybody's focused on getting the vaccine out, and that helped the operation move more quickly. But is it safe? Is it safe? And what's going to make me and our families feel comfortable that this vaccine is safe to take?
Okay. Well, the first thing I can tell you, Pastor Edmonds, I just have to share, since we're in a spirit of sharing. I participated in the Moderna trial. So I was a study subject and enrolled in that study. And I did so because I thought it would be safe and I thought it would be effective. I didn't know what I received when I was inoculated because we were all blinded. None of us knew. Now, my arm hurt a little bit. And after the second shot, I was, well, let me just say I was a step off my game for a day. And so I thought I received vaccine, but I didn't know for sure until I was unblinded a few weeks ago. And thankfully, I did receive vaccine because I sure whined to my wife an awful lot about it. And she wouldn't have let me live it down if I was a placebo recipient. But it's amazing, the studies that were done before the big clinical trials enrolled hundreds of study subjects, and they had been followed very closely and incredibly closely for several months. And what they reported as side effects, arm discomfort. A lot of people reported fatigue after the second dose. A few people reported a low-grade fever and a sense of chills. But no other untoward effects were noted in those early trials. And then Moderna enrolled 30,000 study subjects. Pfizer enrolled 44,000 study subjects. And we have safety data now for all of those individuals, in addition to, gosh, it's over 20 million Americans who have received one or the other of those vaccines. The only adverse event that we've picked up now that causes us concern is a few cases of anaphylaxis. What that is a severe allergic reaction.
Yeah.
I have to say it's exceedingly rare. A couple dozen cases in all of the vaccines that have been administered. And folks like Mohammed are really, really good at taking care of that because they often will come in the emergency department. And what we do is after giving the vaccine, we observe people for a half an hour just to see if those untoward events occur. We haven't seen one thus far in Pittsburgh. We haven't, and my gosh, we're on the lookout for it. But I'm convinced that this vaccine is safe. I guess I was sufficiently convinced that I stepped up and volunteered, and that's probably the most sincere level of conviction that I can provide.
All right, Doc. So we're going to be coming back to you for some more just direct viral questions or
Sure.
questions about the vaccine. I want to come now to Dr. Chinta's Pettigrew and Dr. Margaret Larkin's Pettigrew in terms of, again, honing in on the safety of this vaccine. If we're just keeping it 100, if we're keeping it real, right? We oftentimes in Black and Brown communities want to hear the words from Dr. Dermody coming from Black and Brown people also, Black and Brown leaders in the field, because there has been some mistrust, not even some, there's been a lot, and there still is, because of the inequities in healthcare that we still see in our healthcare systems, right? We can see even the morbidity rate of African-American women in labor is higher for whatever reasons in certain areas than in others, you know what I mean? And so there's clearly a disparity between Black and Brown bodies and the majority white population in our country and even around the world. And so Dr. Pettigrew, I want to ask y'all, from your perspective, is this safe? Is this vaccine, or are these vaccines safe? And what do we as people of color and as a community need to be mindful of in this process? I'll go ladies first. Dr. Chinnis, I know you'll let your wife go first, and then we want to hear from you as well.
So, as an OBGYN, taking care of patients living with HIV, being close to the science, and really participating, as many of you have in some of the studies, I trusted the science, and I really wanted to make sure that people who look like me trusted the science. And at the end of the day, when you look at all of the vaccines that have been administered across the country and across the world, that we've had about 111 reactions that have been taken care of, 2 hospitalizations that were did not turn out in death. We've had no deaths from the vaccine. And so looking at that and then comparing that to the fact that we as African Americans, four times the number of folks who can be infected, 2 times the number of folks who've been hospitalized and intubated, and 3 times the number compared to Caucasians who have died. So when you compare death versus what's happening with the vaccine, you don't have to be a rocket scientist to understand that if you don't take the vaccine, that you are jeopardizing your entire family, your legacy. We all need to step up and be responsible and take part in it, because we're older. You see the gray hair that you're looking at now. So we've lived a long time. So we've been through some of the trauma of other pandemics per se, right? So things that kill people, things that like polio, that we lived through that and watching people with that situation. We work internationally. We watch generations of people die from HIV. My patient said to me, I am not afraid of taking this vaccine. I am afraid of not taking it because I am much more, as an HIV patient, I am going to die if I don't take this vaccine. So we want you to trust the science. We trust the science. We know the science because we've been close to it. And 4 of my children have had COVID. And talk about fear, a mother whose children are suffering from COVID. And so I'm encouraging you all that this is part of, if this is important to your legacy, if you want to see generations live beyond this pandemic, then I think you need to know the information, trust the science, and take the science. Take the vaccine.
Dr. Chintis, I want to come to you specifically. Also, because I know your background and your teaching. You have held positions at a lot of places, but one of those places is Tuskegee University. And so we know Tuskegee is the site of one of the most notorious really travesties of healthcare injustice and inequity in the history of our country. And so what do you say to those who are leery of taking the vaccine, and how can we be mindful of those issues in this time?
Well, I would say, having lived in the Tuskegee environment, you understand what an observational study is all about. The vaccine development was not a situation where people were using people to observe outcomes that really had no intervention. This was a totally different situation. I would say several things. One is the people that I work with in my environment are people that really support the work that I do. I look in their eyes every day, and I can tell you, when you have your antenna up, when people are true or they're not true. Dr. Dermody won't really admit to this. I mean, he will admit to it, but he won't say this about himself, but he has been very committed to the equity effort in our environment. There have been a number of scientists, including Dr. Herberman, Dr. Wells. They all dropped what they were doing and started to work. But the real thing that I can say about the scientists that were in the Tuskegee environment and the scientists that are working now in this situation, they have a high level of ethical practice that is very clear to me. The scientists in the Tuskegee environment were not ethical. They were deceptive. The folks that I see every day that help me every day, that open up their departments, their faculty members, the scientists in their departments are very ethical scientists as well. So for me, watching them operate outside of the pandemic gave me confidence that when they decided to drop the things that they were doing and focus, that their intention was to develop the vaccine, and we could trust the outcomes. If they said it's ready for a human trial, then it's ready. And I, as well as Dr. Dermody, I was a human subject. My wife was one as well. But unlike the physicians, they gave me placebo. I think it was intentional, but I got placebo. I was not vaccinated until I gave my last shot Friday morning. But be that as it may, I stepped up because I felt that with 43% of the folks in our community saying, well, I'm going to wait, I don't know. I used to spend a lot more time in the barbershop than I do now. But the issue there is
me too, Dad.
Yeah, I got you. I feel you. The whole thing about being and getting the truth to the men in our community was very crucial to me. So I wanted to be an ambassador for the people that I work with and the efficacy of their work. In addition, I wanted to be a trusted voice because I know that if I said I stepped up before they had all of the human subjects that they have now, then I can say that I trusted what that work resulted in. I have started on the path, so I'll get my second shot Friday.
Yeah.
Hopefully I'll be immunized. But I trust the people that support the equity, the diversity, the inclusion work that I do in the University of Pittsburgh School of Medicine and the UPMC Medical Center. And when they went to work, I trusted their wisdom, I trusted their intellect, and I trusted that they would be telling the truth, that this was going to be something that was safe and effective.
Wow. Wow, that's heavy. You've shared, both of you all, Doctors Pettigrew, have shared some powerful pieces. What I'm hearing also from you, Dr. Chintis Pettigrew, is that there was an eye towards those who you have seen operate ethically and those who you have personally seen function in this space. And at some point, we've all got to place our trust, right, in something that is, or someone that is beyond ourselves. But you can say, hey, I know these people and I can believe that they are going to work on behalf of all of humanity and not just folks who may look like them or who may be in the same social stratosphere as they are. So that's powerful. I also want to point out that you all both have had or both signed up for the trials. Then Dr. Dermody announced that he also signed up for the trials. And I want to highlight that as we talk about faith in this conversation, right, there are some who could argue that, hey, you know what, I'm trusting God, and so I'm not going to take the vaccine, and I'm trusting God to keep me. But there's also an intense level of faith that is required to say, I'm going to step up and I'm going to allow somebody to put something foreign inside of my body because it actually may save somebody else. Wow. And that really, I mean, even just connects with the story that we celebrate and the heart of our Christian faith in what Christ does on our behalf on the cross, that others might not have to experience some of that pain and some of that trauma. And so I just want to highlight that as we wrestle, family, today. And I'm speaking to those who are watching and tuning in, that as we are seeking God for wisdom, that we recognize it's going to take faith on both sides. It's going to take faith. If you don't want to get the vaccine, if you're fearful there, it's going to take faith. If you want to get the vaccine and have anxiety there as well. And so I think those are some important pieces that you all are lifting up. I want to come to Dr. Villalobos. She is, again, a third year medical residency intern right now serving in Honduras. And I'm sure that you, Dr. Villalobos, like me and others, have some friends in our age range or my age range and your age range who are saying, well, hey, I'm 30 something, maybe I'm 40 something, I'm 20 something, right? This virus has really shown very clearly that those who are 65 and over are going to be the ones who have been impacted the most dramatically. And so I'm hearing, like many folks, I'm hearing a lot of conversation about, yeah, I'm not going to put that in my body. I don't know what that is. Are they going to alter? Is that altering my DNA if they put that in my body? And so I want to hear from you in your work. What have you been hearing from millennials and Gen Xers about the vaccine, and how have you responded?
Thank you, Pastor. I hope everyone hears me clearly and my internet doesn't get a little choppy as I speak, but I think a lot of this that you're asking is addressing the fears and anxieties that surround COVID and the vaccine. That actually isn't that unique to the millennials, but I do hear it a lot. A lot of those fears and anxieties across the board. A lot of millennials, I think, are when I say millennials, it actually includes a larger or older age range, right? When we think millennials, I think younger than me, but it actually includes me, includes you, Pastor.
Yeah, yeah.
And so a lot of folks who are outside of that over 65 window have that mentality sometimes that, well, it's really not going to affect me. Why should I care? And there's also the disbelief, right? Which also exists amongst a lot of people where I don't even know if this is really real, right? They don't get to see the direct impact. They don't see people dying, where I, only in my short practice of a couple of years as a doctor, have been seeing a lot of my patients die and taking care of them as they're passing and talking with the families who can't even be there physically as their family members are dying. And that's a heavy, heavy thing. So when you see firsthand and you know of it happening, you don't really question it, but a lot of folks aren't living that, right? When you're young and healthy, you're a lot more oblivious to things. You're not in and out of the hospital. It's not really your life to think about. People, when they're older, they're thinking more about taking care of their health and their wellness and doing their checkups with their doctors. But young people, we don't see them. And so it's really hard to engage a community who is not necessarily thinking, well, there's anything wrong that happened to me. The disbelief that's being spread around, whether to believe it or not, unfortunately, everything got politicized, right? When it came to this virus. And it was in a time of heat with politics involved, and somehow it became split. So where there's all kinds of things being said, oh, this isn't true, this is true. The trolls all over the internet, it is everywhere. It's hard to decipher what's real and what's not, what to believe. And so you have this unfortunate ripple effect of the young folks being conveniently easy to say, well, I don't really want to engage in that. I don't want to really believe in that. I don't want to really participate in that. And one of the things I can say is, well, before and in the beginning, it seemed like it was just the elder folks who were at risk and those with comorbidities were at risk, but that's no longer true. We know very well, we have a lot of folks in all the age groups having very, very severe outcomes, including death and a lot of really bad conditions from it. So you have this actual very concerning reaction. We kind of call it the Kawasaki of COVID in young kids. And we actually are very much on alert and always looking out for young kids to have this reaction. So you expect a little child to be able to run off this cold like a regular flu, and it's not necessarily the case. You have to be really concerned for a child actually to have a really bad outcome. And then all of the folks in between, you have people passing away. You do have people who were young without any other condition dying. And it's really scary to see that, because I can kind of maybe put my feelers out and think there's this condition, they might turn the corner and they may tank from here, they may get better. But when it's someone who's young and healthy, I'm not expecting them to crash and to go downhill, and yet they still do. And it's such an unpredictable virus. It's such an unpredictable virus where I see people from one day to the next. I have someone on 2 liters of oxygen, the next day they're intubated, and some people are home. And it's hard to say. I mean, even me and my own family, I have young cousins, unfortunately, who have passed away, where an entire family, unfortunately, has been now wiped out. My cousins, my young cousin was infected. She had a really bad course and was in the hospital for a very long time and thankfully survived. But now her brother is intubated. Her other brother has deceased. Her father and her mother are her mother has passed away now and her father is like intubated. And they're pretty much vegetables on respirators for a long time now. And it's pretty humbling to see that, where even the children have died before the parents, and they're not in a very good state. And so there is like one survivor in that entire family right now who actually had COVID a couple months ago in a really bad, severe situation. Like, you have entire families being wiped out, and it's no joke. And when you see this firsthand and know about it, you can't take that lightly. And I kind of take it as like, I understand where people come from, but it is also my responsibility to just try to be there and work through and be that voice to say, hey, I can see where you're getting that logic, but it's not necessarily true. And if you'll hear me out, I need to talk it out with everybody and say, this is actually not the case. This is not the case at all. And this is very severe, and we need to take it seriously for our community. And what's something so hard that I see in the US, I'm gonna say in this country, but I'm not in the US right now, I'm in Honduras. In the US a lot, it's hard to get people to connect under the theme of for the community, you know? Everybody has different religions to say, for God, literally, he wants us to help our neighbor. That is literally our jobs as human. We are supposed to be living in communities with others, helping our neighbors and helping each other out as we are family members to each other. But it can't have that communal thing with everybody, you know, not everybody in the same religion. Well, in other countries too, you have it, it's for the community, that's what it's about. But a lot of folks, it's not about that, with the individualism, the capitalism to say, this is for me and for me to advance. And so that mentality is sometimes difficult to kind of like work against and hopefully find a way to mesh it, to say that a lot of this is for community protection. Yeah. I can keep it very real with people. Some people I'm like, I'm not concerned for you to get the flu. I don't think you're gonna die. You might have a really bad case and you'll be in bed for 2 weeks and it's gonna be awful. But I don't know if I'm concerned for you for passing away, but I'm really concerned for the people you're gonna be in contact with, for the little babies and the older folks who are gonna die. For COVID, I'm like, yeah, actually, I can't say that with confidence because I've seen people pass. And so I am concerned across the board, more so for the folks who are elderly, more so for the folks with like chronic conditions, comorbidities that we know have had huge impacts. But I cannot, you know, knowing the information that I know, not put in that effort to pass it on. Right. What I can say to some of those stresses and anxieties though is, I hear what you're saying. If you hear me out, this is maybe where it's coming from. Like vaccines, okay? Vaccine fears. There was a doctor who literally made up the fact that you get autism from vaccines. Ask someone down the street if they think autism is from a vaccine. They say, yeah, probably, maybe, because that's still an innate belief, still to this day. This is fast forward a couple of decades ago, though. This doctor has lost his license, has been incarcerated. The truth has been exposed. Researchers, scientists, doctors, we all know the truth. But that actually still is ingrained in people's heads. You still have Jenny McCarthy, who had been a spokesperson against this, right? Say, don't vaccinate your kids. We got to protect the kids. I understand where she was coming from, but something was made up. It wasn't truth. And then when the truth came out, they didn't come out and say, oh, sorry, everyone. So this is where we get a lot of the kernels of the lies come from. So I say, I hear where you're coming from, but let me tell you how it's not true. And so then the other part of the vaccine is, well, a very quick vaccine does sound a little bit scary. Pastor, you mentioned 10 months. Is that quick? Is that enough time? And I even had that thought. My mother asked me that question. Miha, is this like okay? Or have we had enough research for it? And I was like, good question, really good question. But the technology of this vaccine is not new. We actually have 5 to 10 years of research with these vaccines. It's the technology that we've been working on. And then back when Zika was a big scare for the US and with the spread, they were going to implement it and use it then, but didn't need to. So this technology has actually been worked through, and now we just had a new vaccine and find a new coding piece to use it in that vaccine. And then now we've been testing it. So we were at the point where we could test it on folks, and we have had enough time. We've been able to take the same protocols and procedures that we do in research and in science so that folks who are providing medicine can believe and trust it as well. Right. And so then part of that is to say, hey, I hear where you're coming from. And then here's some of those reasons why we can actually feel comfortable more about it. And why I'm so passionate about it spreading is because our folks are the ones who are most affected. Black and brown folks are dying, and it is appalling. And there is low access, low help, low resources already. And when you're having a community already at the bridge of instability and you throw them with the virus, a pandemic, everything really goes downhill. And so we are really needing to be spokespersons for our community and looking out. And then knowing, hey, we're the future. If you're young, you need to step up and say, you know what? I owe it to the future, the generations to come before me, and the folks who have brought me here to where I am. To acknowledge that wherever you are, even if it's not a great place, You were there because of the folks that came behind you. You're there because of the work on the backs of the people that came before you. And so it is unto us to think about and step up and be those spokesmen and then really put ourselves out there. And so if you don't think that that's going to help, but all it takes is a poke, take a poke. You know what I mean? And so then it's like, think about what it could potentially benefit. If it means that you got a water pill and it didn't do anything, but you just took a pinch, take a pinch. But the potential of the benefit is to save lives of your community. Why wouldn't you do that?
Yeah.
Or your own life.
Right.
And so
Yeah.
I hope that people can hear that.
Right. And Doc, I definitely hear you. And I think a lot of folks on this call, I would agree with that. But, we still have to be mindful, right, that there is a history of sometimes misinformation, right? Like you talked about with some of the other vaccinations, as well as a history of disparity, right? That says, hey, this hasn't always come to our communities in the best way. Couple of points I want to make, and then I got to hit y'all with some rapid fire questions. But one of them is, to your point, because of the disparities, and many folks from our church may be watching. Of course, we stream online every week, but because of the disparities, that's part of the reason why I have led us into not gathering together again as a large congregation just yet. Partly because, not because I didn't think that there was some safety protocols that we can put in place, but if you recognize that the access to healthcare and the access to medicines and the access to, even once you get to the ER, are you treated equally, right? It impacts Black and brown bodies in a significant way, so that we need to be mindful of what kind of things we do as leaders in the community as well. All right, so thank you all for all of what you've been sharing so far. A lot of questions coming in, and I wanna do some rapid fire questions to some folks. So Dr. Hagamed and Dr. Dermody, question, and I'll come to you, Dr. Hagamed, in terms of reasons not to get the vaccine. Are there any allergies that people should be mindful of, or other prior or pre-existing conditions that people need to be mindful of in terms of taking the vaccine at this point?
Yeah, that's a great question. So when it comes to the recent COVID-19 vaccines, and I'm just going to speak to the Pfizer specifically and the Moderna vaccines, unless you have severe, and Dr. Dermody mentioned this before, severe anaphylaxis, which is a reaction that is so severe that results in closing your lungs, you're unable to breathe.
Right.
So for example, for folks who had severe anaphylaxis to certain medications, other medications, including previous vaccines or previous reactions to products that are contained in this vaccine. As you know, Pfizer and Moderna has to be preserved somehow, because the lifespan of that vaccine is very short. It's an mRNA vaccine. It doesn't live very long outside the body, as you know. So it has to preserve it somehow so you can keep it as effective as possible. So if any of my patients had previous reactions to any of those preservatives, then generally they are not encouraged to get the vaccine. Or unfortunately, I mean, some of them can actually, like, if they have like a severe reaction to previous vaccines, then they have to get guidance from the primary care physician. And I'll give you an example here. One of our nurses had severe reaction to one of the preservative in the Pfizer vaccine, and she actually got the vaccine under the instruction of her primary care doctor. We were there. I was there personally. We had our EpiPen, which is a medication that we use to treat anaphylaxis. We observed her for 15 to 30 minutes. She was fine. Nobody had any complication, and she went home.
Right. Okay. Great answer. Great answer. So just to clarify for some folks who are watching, and many of us may have heard the term anaphylaxis in specifically in relation to different allergies, like a peanut allergy or some kind of allergy where somebody can have an allergy reaction that closes up their throat. But part of what we're hearing you say, Doc, is that others can have an anaphylactic reaction to some of the things in different medicines. But I'm also hearing you say that we have not seen that in the research at all, pretty minimal across the world at this point from the numbers that are reporting. And so that's part of why people are saying this vaccine is safe, or these vaccines are safe. Dr. Dermody, I'm coming to you. Some are asking, hey, which vaccines are better? Is Moderna better than Pfizer? And we hearing this question a lot. We do understand that one vaccine has to be stored at colder temperatures, for longer. But is there any reason to say, hey, my body might work better with Moderna, or my body might work better with Pfizer? And how would we know that?
Thanks, Pastor Edmonds. Those two vaccines, for all intents and purposes, are identical. The Pfizer vaccine needs to be stored at a very cold temperature, really up until the time it's used. The Moderna vaccine can be stored in a refrigerator for for a month before it can be used. But the basic vaccine is what's called mRNA. mRNA encodes the instructions to make the spike protein of the coronavirus that the immune system reacts to. That's what makes the antibodies that prevent you from getting infected with the coronavirus, that mRNA. And it's encased in a lipid vesicle, like a soap bubble. And that soap bubble is really fragile, and it has to be stored at a very low temperature in order to maintain its potency. But both those vaccines have very, very high levels of effectiveness, and for all intents and purposes, they're the same. I have to tell you one statistic that just blows me away. When you combine all the vaccine trials that have been done so far in the U.S., this is Pfizer, Moderna, Johnson & Johnson, and AstraZeneca. There's a total of, in round figures, about 60,000 vaccine recipients. We started enrolling in these trials in the summer. And do you know there's not been a single death, not one single death in any one of those vaccine recipients? I just say I find that really remarkable. Yeah. So there may be some slight differences that you see when you read in the paper, but these vaccines, at least right now, today, all prevent the severest forms of COVID-19 and are really safe.
Okay, great. So I'm gonna hit you with some follow-ups there, Doc, because again, we're getting the questions coming in hot here. So with these vaccines, right? So you talked about the mRNA. Do these vaccines alter our DNA? And so that's been a concern for some folks. Do they alter my DNA? And then I'll give you a second one. Is the vaccine a live virus or a live viral vaccine, or is it not? Help us to understand this.
Okay. These vaccines, none of these vaccines, Moderna, Pfizer, or Johnson & Johnson or AstraZeneca can alter our DNA. It's impossible. They can't do that. All they can do is make a tiny part of the virus that your immune system responds to. So no worry whatsoever about altering our DNA, our genetic code in any way. These vaccines are not alive in any way. So someone who's been vaccinated can't transmit COVID to anybody. There's no virus there for a vaccinated person to transmit. What they do is they induce antibodies that prevent the vaccinated person from becoming infected.
Okay, well, let me push you on that too, just so we can make sure we got clarity, because I believe what you're saying is when I'm getting vaccinated, I cannot then transfer that to anyone else.
Correct.
But it is possible that once I am, this is where people need to get the clarity that once I am vaccinated, what that does is prevent serious disease, but it does not completely prevent me from contracting COVID. It just ideally would prevent me from getting really sick with COVID, which also then means I could transfer, or I could spread the virus to someone else through the particles. That's possible. Is that correct, Doctor?
Pastor Evans, you should come and work with me, and so that you can give vaccine lectures. That's a question I'm asked a lot, and that's the answer I give.
Okay.
What we know with absolute certainty is that the vaccines protect a vaccinated person from severe disease. We absolutely know that with certainty. We do not know whether the vaccines diminish the risk of transmission. So it's quite possible that a vaccinated person could get infected with the COVID virus and never know it because they don't get sick. But the virus is replicating in the nose, and when you sneeze or cough or even talk loudly, you could spread that virus to somebody else. So
Right.
this is why it's really important, even if you're vaccinated, keep your mask on, okay? We got to keep our masks on until the numbers go way down.
But that's what I was going to ask, and people are asking, how long I got to wear this mask? That's,
Yeah.
you know what I'm saying? Like, you know, because when we go get vaccinated, people are saying, look, I'm going to get vaccinated. I'm ready to take my mask off.
Right.
But Doc, I hear you saying we got to keep wearing our mask.
Yeah, yeah. And so here, the most important thing to share in this sense of community is that we get vaccinated for two reasons. Of course, we get vaccinated so that we don't get sick with the COVID-19 virus, but I think it's more important that we get vaccinated to protect those who we hold close, especially our elders. This is a virus that comes after folks who are our elders, and it's a much, much more severe infection in those who are over the age of 70 than it is those who are under the age of 50. It's really remarkable. Not everybody over the age of 70 can develop a really good immune response even when they get one of these vaccines. So they depend on us. They depend on us to be vaccinated and to protect them from becoming infected. Vaccine is one part of that protection, one part.
Yeah.
A mask is another part. Trying to limit lots of close contact with each other is another part. Why we have to have this meeting by Zoom and why we can't be together. This is all to protect those who we hold close to us, our elders. And that's why we have to do it. Now, when can we take our masks off? When the numbers in Allegheny County and throughout the state and throughout the country are way, way down. So COVID becomes something that's rare, unusual. And so we don't have it in our community. Then we can take our masks off. And I'll tell you, I don't want to make a big prediction about the future, but do you know that in our entire UPMC system, since we started testing for influenza in the first part of November, that we haven't even had 10 cases?
Wow.
We haven't even had 10 cases because we're masked and we're distanced and we're not together in close contact. So I suspect that many of us who don't favor the flu, we're not like, we don't like it.
Right.
We may be wearing masks in the winter a little bit more frequently than we had in the past because we don't like these respiratory viruses, COVID, flu, and others.
Wow. Okay. All right. These are great answers. Can you give me a in terms of prediction? You know, if we had to make a prediction, right? Thinking about if folks are moving forward in this way, what we're seeing right now. Of course, there's still been struggles with the rollout of the vaccine. You know what I mean. So if we are moving in a good direction, when do we foresee numbers going down? Are we talking summer? Are we talking fall? Are we talking 2022?
Yeah, what a good question. And there are others on the panel who have thought about this deeply too and may want to weigh in since we're all, putting our over under, what the over under to taking our masks off.
Yeah.
I think that by late spring, early summer, vaccine will be distributed to every American who would like to be vaccinated. I really think that's true. Right. The J&J vaccine is going to be, this is just an opinion, it'll be reviewed by the FDA at the end of the month, and I bet it will be given emergency use authorization. AstraZeneca will follow soon after that. And there's another vaccine called Novavax that's going to come too. And so this is going to add 3 additional vaccines, Pastor Edmonds, to the current 2 that we have. And the manufacturers are all ramping up to produce millions and millions and millions of doses. And right now, we can't tell you that any one is truly any better than the other in terms of protection against severe disease or mortality caused by COVID. So this is great stuff.
Right.
Now, with this widespread vaccination, and gosh, if we can stick with it, Pittsburgh, oh, please, if we can stick with it, keep our masks on, try and keep distanced, have our meetings that we don't have to have face-to-face virtually, keep our hands clean. We're going to see numbers in Allegheny County continue to decrease, week by week by week decrease. So that the summer, we're going to see, I think, much, much less COVID. And I hope that we can, get in the car and drive someplace where we'd like to take a little vacation, because the world needs it. The whole world needs, a beach and steel drums. I mean, that's what the world needs right now. And I think we'll be able to do that in the summer. In the fall, I think we're going to start easing back into some of the routines that we used to do. Maybe getting into planes, visiting with family and friends. And we'll see what the numbers do. And Pastor Edmonds, if the numbers stay low, we're going to be okay. If the numbers spike up again, we're going to have to peel back and take more precaution. Right. But I think by the end of this year, we can look forward to visiting with our families over the holidays. And I think 2022 is going to be a much better year.
All right. Thank you, Doc. Dr. Hageman, I'm coming back to you. How long am I good once I get vaccinated? These are questions coming in. Once I get vaccinated, how long am I good? Are there long-term benefits, or am I going to have to go and get a COVID vaccine every year, like I get a flu vaccine every year?
Yeah, wow, this is a great question, which is still being questioned by so many scientists. As you know, Pfizer and Moderna vaccine, they both require a second shot, ideally within 21, 28 days apart. And most of these vaccines, in terms of the study and the data, we're looking at outcome within months, right? We're looking at your likelihood of getting the disease within months, not within years, because most of these studies are still brand new. So the short answer to your question is we don't know. We do not know. My opinion about this is that this is going to become a yearly thing, just like the influenza vaccination. Because every year, I believe that most folks will require a booster shot. That way they can still continue that robust immune response to COVID-19. So hopefully within the next few months, and I'm sure Dr. Derby will be able to add to this, we'll be able to get more data, we'll be able to know more about the long-term immunogenicity of this vaccine, hopefully.
All right. So before I come to you, Dr. Dermody, I just want to follow up with that. In terms of what makes this vaccine different, or these vaccines for flu and COVID different than the vaccines that we get for polio or measles, mumps, rubella, right? So those things, right? The kids take them, once or a couple times and they're good. But flu and COVID, we're taking these possibly every year. What's the difference?
So I have so much respect for viruses. Viruses are very smart organisms. They mutate. Mm-hmm. And the thing with these very small, tiny, invisible organisms, they jump between species, they change certain things, certain shapes, certain proteins. So specifically when it comes to COVID-19, as you all might have heard of this COVID variant in South Africa and UK. So now we're seeing different types of the same virus showing up. And most of it is because the virus is basically smart, it's trying to deceive the immune system. So these vaccine that we have now target a certain, receptor, a certain protein that is on the surface of that virus. And that protein, like many proteins in so many viruses, can change depending on species, certain variations, time even. So for right now, what we know is that these vaccines are effective. So Pfizer and Moderna they do have some or provide level of protection to even the variant of COVID-19. Other vaccines don't provide that level of protection. So this is all things now are happening, and as we continue to get more information about this, we'll be able to know more in terms of what vaccines, what do we need to do to change the level of protection to people.
Okay, great. I think Dr. Dermody, you were getting ready to give us another response about how long we're good for vaccination.
Yeah, I'm slower on my unmute. You know, it's one of those things that comes with age. You just can't get to that unmute as fast as you'd like to. And that dexterous Mohammed is just right there. And so, you know, Mohammed has it exactly right. There are really two variables. One is the variable of how the immune system responds to the vaccines. Some vaccines elicit very high levels of antibodies, and those antibodies last in you for a long time. That's polio, Pastor Edmonds. Measles, mumps, rubella is another example. The other variable is how fast the virus is evolving. Some viruses don't evolve very fast. Polio and measles, for example, very slow in their evolution. Flu changes so quickly that we have to get a flu shot every single year because the virus is different every single year. With the COVID virus, SARS-CoV-2, it looks like the antibodies last quite a long time. So we started immunizing people back in the spring of 2000 in the very first trials, and they have high levels of antibodies now. So almost a year out, they still have high levels of antibodies. It's very encouraging. But the virus is mutating. And so what we don't know is, okay, so how fast is it going to mutate? And the variants that are produced because of evolution, how resistant will they be to vaccine? And Mohammed is exactly right. Only time is going to tell. And I would just say the key point here is that the faster we drive this virus to very low levels, the lower the risk of new variants coming.
Exactly.
Okay, so at the risk of sounding like a broken record, masks are really good.
Right.
They're really, really good and help us drive the levels low.
All right. Great. So y'all, questions are coming in like crazy, and we got to end at some point. So I'm gonna do a couple more rapid fire before we end on this session. But I know there will probably be some more follow-up combos that we're gonna have. And so again, thank you all so much just for hanging on with us. Dr. Pettigrew, I'm coming to you, and we can jump around to others as well, but I'm just coming to the different medical professionals. Dr. Margaret, will you explain, or can you help explain the term herd immunity? We're hearing this term, a lot, and I'm sure others on the panel can chime in. We hear this term a lot, but what does that actually mean to us, and how will that impact us?
So, the virologist probably could answer this better, but we all know that if we have a virus that we just allow to infect one another and it spreads throughout communities, that eventually the hope is, and herd immunity is, that we gain enough immunoglobulins in our system that we just are protected, so that many of us are protected. And so that we don't have to be vaccinated if we can, in ourselves, with our own immunity, can then produce enough antibodies to protect us. And so that's been some of the hope that the conversations that we've had all along, is that we just let it take its course, and then it would take care of itself, and that we would all eventually be immunized because of the natural responses that our body does, because many of us have these intact immune systems. But we know for sure that that is a high risk behavior because of the number of folks that we have seen die and continue to die. So that is not the option that we should be taking, right. To just kind of sit back and do nothing. We need to really engage in participating in taking the vaccine so that we reach which you would consider to be herd immunity, or we're all immunized and have immunoglobulins that we are all protected so that we're not giving one another the virus and that many of us are not dying from it.
Right, right. So as I'm understanding what you're saying, and even as I've watched others, that there's a certain level at which we can get to where enough people in our community society have the proper immune response to this virus, that it won't be spreading as quickly. But what I'm also hearing you say is that vaccination can also accelerate herd immunity. If we're vaccinated, properly, then herd immunity will become, more likely, because the vaccine is giving us the right response that we
absolutely. So it really helps us build up that immunity much faster
right.
if we are vaccinated versus getting the infection.
Okay, great. Thank you for that explanation. I'm coming to some more. Are there things, and we may come back to the virologist here one more time, and then I want to get some quick practical questions as well. But are there things in the vaccines that could have contraindications or interactions with other medicines? Specifically, I got some folks with diabetes, who are asking, hey, can something impact my diabetes medicine? And so then, have those studies been done enough to show that, yeah, I'm going to be okay to have the vaccine and my diabetes medicine, or the vaccine and my cancer treatment? What should I do?
Yes. Pastor Edmonds, I think the safest thing to do in these circumstances is to consult your primary care provider, and just the person who knows your health best, and just discuss with that individual whether the vaccines are appropriate for you. I would say that with all of the testing that has been done, many of the study subjects, and of course now many people we have immunized, have had coexisting medical conditions, including diabetes. And it doesn't appear that any of those conditions place someone in an increased risk. With regard to cancer, it really depends on the nature of the treatment, the chemotherapy, the immune suppression. And it's not really that the vaccines would be at risk, that they would cause risk in those people. It's just that the vaccines might not induce the high levels of antibodies that we would hope if the immune system is being suppressed due to cancer treatment. But the most important message is that we don't know of any interactions with the vaccines with any kinds of treatments, but please check with your primary care provider, the person who knows you best, to get a recommendation about, when to get the vaccine and so forth.
Great. So thank you again. So that leads me I want to transition here real quick in terms of, all right, you got to talk to somebody to get this vaccine, but there's a lot of confusion on how do I get it? And so, Dr. Gadsden, you've played a huge role in this recent rollout in the Hill District last week. And so folks are asking, all right, one, is there going to be another Hill District vaccination coming soon? And then you can start to help us answer the question of, how else do I get the vaccine? And we can come I would want to come to Pastor Shirley to ask you how you got it, because I'm aware that you received a shot, posted it on Facebook, encouraged some folks, right? And so I'll come to Dr. Trish and then come back to Pastor Shirley.
So first, what I want to share is how fortunate we are to be in Pittsburgh to have advocates on our behalf to dispel myths. As earlier, there was some conversation about the real concern around the myths and the distrust that historically occurs in communities of color. And so I am aware, and I have talked to people who have heard the statements and the public interviews of Dr. Pettigrew. And that goes a long way with talking about what exactly is happening. We are extremely fortunate in Pittsburgh to have Father Paul Abernathy and the work of the Neighborhood Resilience Project right here in Pittsburgh, people from around the country are looking at what Father Paul is doing in terms of educating communities. And so Macedonia Face was able to partner with Neighborhood Resilience Project in conversations with community partners through the Pitt Community Engagement Center, the Allegheny County Health Department, and where we were talking about equity. And so what I shared earlier is, as a social service agency, we talk about the social determinants of health. And what I mean by that are the social and economic impacts that and the inequities that impact the health of a community. So we have been having conversations with Dr. Deb Bogan at the County Health Department and her team, and they've been open to engaging us in conversation about the fact that there is a disproportionate number of African Americans who are receiving the vaccine, and a structural inequity with the rollout. Because, for example, in order to register for the vaccine, you need to be able to have access to technology and internet. Right. So if you're looking at wealth disparities or under-resourced communities, that becomes problematic. And so what happened in the Hill District and is currently happening in other under-resourced communities in Allegheny County is we created a mechanism where seniors 65 and older could dial in to us, and our staff, our teams, Macedonia Face and Neighborhood Resilience Project with volunteers from the University of Pittsburgh, and we began to register seniors, and we began to address some of the other barriers, such as providing transportation and taking the time to go through the information for the registration. And so that is how we were able to facilitate through a community-led, community-engaged effort to facilitate over 1,000 people being registered this past, not just registered, but to receive the vaccine this past weekend. So we had conversations with the health department again about not just getting the first dose, but assuring that we get those folks back for the second dose. And so again, making sure that folks who don't have email, we are communicating with them to say that it is significantly important that you come back for the second one. And if you don't have transportation, we will help devise a plan to make that happen. And then also talking to the health department around the need for assuring that Black and Brown residents in Allegheny County have access to these kinds of resources. And we are continuing those conversations and putting those plans in place.
Okay, thank you, thank you. That's very helpful, Trish, Dr. Trish. And so I want to come again now to Pastor Shirley. So you talked about folks, trying to get the vaccine, and Pastor Shirley, you got the vaccine. Can you tell us a little bit about, at least I know you've gotten your first step, maybe not fully inoculated just yet, but you got your first step, and you also had COVID, right? So some questions are, do you have any reaction to the vaccine once you've already had COVID? Is there any kind of difference? So you can tell us about your experience as well as what you had to do to get it. Was it because of your work in UPMC, your job as a service provider, as a manager, or what led you to be able to get it?
Can you hear me?
Got you.
All right. First, I want to say I was not a believer of the vaccine. I think that's very important for me to identify. I was very fearful, and I would walk around with fake faith. So I would say, I'm gonna pray about it, but it was really covering up a fear that I had about getting the vaccine. And it was people like Dr. Pettigrew and trusted doctors, not just Black doctors, but doctors with integrity, and some of the things that we were talking about that really helped me to shift from this, I'm gonna pray about it and not pray about it, but really operate in faith. And so I love when you said it takes faith to do both things. And so faith with that movement. When I got the first shot of everyone, I do work for UPMC, so I did have the privilege of getting the shot because I work in childcare. I'm in close contact with patients and things of that nature. I was privileged to have the shot early. And luckily I changed my mindset so I could receive it. But the other question you asked is that I had a different reaction. Of all the people I know that got the shot, I was the only one, it seemed, that felt sick after the first shot. So the first night I had pain in my arm, right? And that was, I expected that. When I woke up in the morning, I felt sick. I felt a little lethargic. I felt a little sickly. And it kind of made me feel a little funny about it. I started wondering, did I get the right shot? What shot did I get? All these things are running through my mind. But again, I made the decision based upon trusted doctors. I made a decision based upon just having clear insight. And I also made a decision based upon faith. God was saying, you keep saying you're going to pray about it, but did you pray about it, right? So are you using faith to cover up fear and make it seem so religious, when you're really not asking me, seeking me, or seeking the resources I put in place to provide you with guidance, right? And so that has really been my experience. I am scheduled to take the second shot tomorrow. I didn't take it today because I was afraid that I could get sick again and I would be on the line, right? But again, like the doc said, no one has died, and I trusted that. And I also trust God. A man makes his plans, but God orders his steps. Like, we talk a lot about faith, but we change what we want to believe when we're really walking in fear. So if we believe he works all things together for good, if we believe we make our plans, but he orders his steps, if we believe these things, then let's believe it. You know what I mean? And get that insight and move forward.
Wow. Wow. Pastor Shirley coming with that heat. Thank you for bringing the real. That's what we need to hear. We need to hear that, right? We need to hear, hey, I was scared, but I went anyway. You know what I mean? And we need to hear all of what you all are sharing. My God, y'all have shared just some powerful stories and testimonies on this line. Some great information and clarity. People they still are going. I know we have 80 some folks on Facebook, another 80 some on YouTube that are still with us right now. Then we've got others on our website and app. So overall, a few hundred, 300 or so folks who are watching and really gleaning from all that you all are sharing. And I'm sure that many are going to watch this broadcast over again as it'll be posted on our YouTube and Facebook pages for people to glean from. A lot more questions are still coming in, folks, and we really just aren't going to be able to get to them all. I'm just looking if there was anything that was critical that I did not get to. I think we got to a lot of the major questions. Of course, people are asking about, when can kids go back to school? When will that be safe? Again, I think you all have already shared about this herd immunity that we're trying to get to, because while kids may not be as impacted by and large as older adults, in order to have school, you got to have older adults in the building. You got to have teachers and cafeteria workers, and you got to have all these other folks. That's, again, I think, pointing back to why we need the herd immunity that was asked about. And so, again, I think a lot of questions are going to keep coming. There are going to be a lot of things that rise up, but people still want to know, what are the steps that I can take? Last question I'll come to, any of the doctors on the line, just in terms of where do I go at this point to find out where I am in line for the vaccine? So we see on the news, we see, hey, group 1A, group 1B, all this other pieces, but we know right now, a lot of the frontline workers are getting their shots. Where do I go if I'm 65 and up to get that information? Or if I'm 40 or 50 and I'm saying, hey, I want to go ahead and take the step, let me find out how I do it. Can anybody give us some insight? I know there's a website that Dr. Villalobos posted, and I'm going to make sure Sonia posts that on Facebook and on YouTube. But anybody else can give us some closing comments on where do I go if I'm ready to learn more about getting this shot?
So real brief, I'll just jump into that because that website I think would be good if you guys can just get that out to everyone. If you look there, they're going to try to consolidate all the different locations that exist throughout Allegheny County for people to access. I think it's important because not just like UPMC, but AGH is also doing a lot of locations and a lot of like other locations that are popping up, like pop-ups, like at the Hill District that already passed. They're planning on doing a lot more. So I think it's important to look there. A lot of the locations are 65 and up, but they are rolling out more and it's very live and active. And so look there. I do want to say real briefly that to add to Pastor Shirley's situation. So if you had COVID, we are recommending that people wait about 3 months before getting the COVID vaccine. So it's an important date frame. I think partly it's because you may have already some immunity that you don't need to necessarily get a COVID vaccine right away. Part of it, I think, is access and availability. And also, if you got the flu shot, wait about a month before you get the actual COVID vaccine. So those are specific timeframes that's important to know to separate. Hopefully everybody's already got their flu shot, I hope. And so then it shouldn't be a problem, but know about that and the separation. And then, you know what I mean? One day we will hopefully get to herd immunity, but a little bit of a clarification point with that is that if you have 99 people in the community vaccinated, that one person is going to be the beneficiary of the herd. So it's about that person who is not vaccinated, who gets comfort and immunity from the herd because everyone around them is vaccinated. So they're not going to have things to transmit or make it worse. And that's what the idea behind herd immunity is because those who aren't having immunity are going to benefit the one and single, but we don't have enough of that. You have to have everybody and then just very few who aren't vaccinated to get the benefit of herd immunity. So that's what that is about. And I just wanted to make that clarification piece.
Pastor Brian, it is also important to point out for seniors who don't have access to the internet that you can call 211 through the United Way, and the responders through the United Way will tell you based off of what your zip code is, where are vaccine distribution sites. They will also coordinate with you through other nonprofits for transportation and also help you to schedule those appointments.
That's great. That's great. So these are great pieces. So 211, let's get that in the chat. 211 for those without access to the internet. Even if you got access to the internet, that's going to be quick to be able to get some information about where you can go. We also got a website, Vaccinate PA is coming as a website where you can see that the different locations that are available. Also, just those important pieces by Dr. Villalobos that 1 month after the flu vaccine, you want to wait 1 month after the flu vaccine, and you want to make sure that if you've already had the coronavirus, COVID-19, you can wait 3 months because there should be some level of immunity that your body builds up to getting it again. So for sure, we've seen people being reinfected after some longer periods of time, but you should be able to have some immunity after about 90 days or so. Then you get your shot. And like Pastor Shirley did, she got her shots or got her first shot and is doing well. For sure, people have been reporting when you get a shot, you're gonna have some soreness possibly, and you may have some mild symptoms, but those mild symptoms are much better than the severe symptoms that have taken so many lives, 400,000 lives in the US alone. So I wanna end us there, folks. Thank you all so much for all that you shared here on this line, on this live stream. For those who are watching, thank you for the time you took to tune in and connect to what we've been sharing here. And I pray that you've gotten some insight, some questions answered, and you will continue the conversation. Right? Again, like many mentioned, we are not meant to be alone. And so let's continue these conversations, healthy conversations in community for the sake of the overall community and all of the people that God has placed us next to. I want to close in a word of prayer because we need wisdom. As folks have heard, they've listened, we need wisdom from God about how to move next. Let's pray. Almighty God, I thank you once again for everybody on this line, everybody that tuned in today and everybody that has shared. I thank you for their wisdom, their insight, their prayerfulness, their thoughtfulness. And I thank you, Lord, again for the reminder of what you showed us in the beginning of this time, that if we desire wisdom, let us ask. In that same book, you said that faith without works is dead. So teach us how to work our faith. Teach us how to walk by faith. Give us the strength we need to be the good neighbors you've called us to be. We thank you and we honor you for this time. I pray this prayer in Jesus' name. Amen. Amen. For all of you who are watching, God bless you, and we look forward to seeing you real soon.